Hi, this is Jen with the Clinician Edge. I'm going to show you my favorite way to palpate the posterior first rib for consideration of a mobilization with movement. If we consider the skeletal model here, it reminds us that the transverse process of C1 and the transverse process of T1 are vertically aligned. That's a nice landmark to find that posterior first rib and first costovertebral joint. You can come off the transverse process or the spinous process, but easier to find the alignment from the transverse process of C1, following it down to the transverse process of T1 to that posterior first rib there. So on our model, as we palpate down from C1 down to T1, just below C7 spinous process, we're on that posterior first rib, costovertebral junction. I'm going to slide out and under that posterior upper trap to get onto the bulk of the first rib there. If we want to regain cervical side flexion to the right, performing a mobilization with movement with an inferior force on the first rib on the left can sometimes be quite beneficial. I'm going to come in with the second MCP radial border of my left hand. I'm going to take up some soft tissue slack as I have him side bent towards. We're going to come in. I'm going to drop down onto that posterior first rib, apply my primarily inferior force with possible subtle changes in direction for posterior, anterior, medial, or lateral forces to gain that pain-free force that's required to allow full pain-free lateral flexion. So I sustain my force as he actively moves into lateral flexion. If there's no pain, I can apply a little overpressure and come back out. So again, when considering palpating that first rib, come off of C1 transverse process down to T1 transverse process, just below the C7 spinous process, follow it out posterior to the upper trapezius.